New and easy ways that chiropractors can now help you through telehealth appointments. Hey folks, I'm Dr. Jeff Williams with Cornerstone Integrated Care right here in beautiful Amarillo, Texas. And I'm coming to you again this week. I want to talk to you about chiropractors and telehealth visits. How, for a chiropractic practitioner, does it make so much sense? And when we're done here, I hope that you'll really consider sharing this information with your family and your network, because I promise at least one of them can benefit from the information. And that's what it's all about in the first place, right? Now, when the pandemic really kicked into gear back in March of 2020, many of my colleagues and we made a fairly rapid pivot. And the question that had to be answered was, if we know that pain doesn't take a break just because a pandemic is taken over, well then how do we continue to care for patients during a pandemic? The pain is still there, right? Patients just no longer had the option of being safely evaluated for a period of time. And for some, that period of time is still ongoing here in 2021. This pivot was much easier for some than it was for others. For our clinic, it was fairly straightforward and a simple transition. With me having a fellowship in neuromusculoskeletal medicine and being an orthopedic specialist, my direction forward was very clear. For me, chiropractic is a profession. It's not simply a treatment modality like popping bones. And while popping bones, also called spinal manipulative therapy, while that is the cornerstone of what we do here at Cornerstone, it is not the sole treatment. It's not the end-all be-all of what we do. It is a tool in our toolbox, and it's the biggest hammer we have, but it's not the only hammer we have. In general, chiropractors should either stabilize or mobilize joints or regions of the body, and popping bones is but one method of mobilizing. But what about exercise? And what about rehab? What about stretching and increasing one's range of motion? That's mobilizing as well, right? What about strength building and supportive activities that stabilize certain areas? What about that? If a person thinks that chiropractic only concerns itself with popping bones, well, then they would understandably have a difficult time imagining how a chiropractor can conduct a virtual office visit. That's understandable. What would that even look like? After all, a chiropractor can't reach through an electronic device and pop bones, right? However, for those patients that realize chiropractic is a profession and not just one modality, well then it's not such a difficult thing to wrap your head around. Chiropractic is an umbrella under which many types of therapies exist that can be used to the patient's advantage. Again, spinal manipulative therapy is indeed the cornerstone of the chiropractic profession, but chiropractors commonly use things like massage and soft tissue techniques, targeted exercises, low-level laser, new shockwave treatments, acupuncture, balance training, biomechanical and postural recommendations that remove the triggers in the first place. And, this is really just naming a few of the things we do. There's lots more. And because of the wide array of therapies available to doctors of chiropractic, there are techniques that we can use to evaluate a patient at a distance through the wonders of technology and telehealth. This allows chiropractors to evaluate their patients from a distance and to make solid recommendations going forwards that can help their patients self-manage their issues from afar. Let me give you an example. Let's pretend a patient schedules a telehealth appointment with us and the patient is suffering from low back pain. Well, I would first determine the history of the injury, which can tell us a vast amount about what is going on with the patient. Then I would observe how the patient moves to make sure and note what hurts and what doesn't hurt, what triggers the pain, and what movement relieves the pain. Does it hurt when the patient stands from a seated position? Does it hurt if they cough or sneeze? Does walking help or hurt? There are lots and lots of questions that can help us really dial in and decide what exactly is causing the pain. Even without physically touching someone, through the history, through observation, and through knowledge of how certain conditions behave, I can usually come to a fairly quick and solid conclusion as to what's causing the issue. Now let's assume I determine the patient is suffering from pain that's caused by a posterior disc herniation that causes pain down the legs when they bend forward. Well, from there, I would be able to guide the patient through some very specific exercises that focus on extension at the waist instead of bending forward at the waist. I would then lead the patient through a comprehensive discussion with regards to proper biomechanics, moving and lifting correctly, and ways that we can manage any flare-ups. Now, the disc patient that had no way of being treated is now able to be competently treated from the comfort of their own home while getting ideas and recommendations for ongoing self-management and prevention of flare-ups. Another great use for telehealth appointments is for second opinions. For example, a patient may live in rural Texas and not have a wide range of options when it comes to chiropractors, medical doctors, or orthopedic surgeons. And many times patients feel that they're getting railroaded into shots or surgery or pharmaceuticals when they're really either against it or just don't trust what they're being told. Many times we develop a gut feeling and we want other options. This is where telehealth can really come in handy and shine. We may be close to 1,000 miles from a patient, but we can still give them an honest and independent evaluation of what we think, and we can give guidance going forward from there. Telehealth appointments really are ideal for these patients because insurance covers the visits, and the patients don't have to drive hundreds of miles to be evaluated by an orthopedic specialist. The pandemic has led to a lot of negative things for all of us, but in times of difficulty and stress, fresh and new things can emerge as well, things that truly help enhance our lives. Now, I absolutely believe that telehealth appointments with an evidence-based, patient-centered practitioner like myself are one of those things. So, call us at 806-355-3000 and get yourself on our schedule for a telehealth appointment if you need one. Alternatively, you can just simply go to the link on the screen there to be taken to our telehealth page on the website. If you're watching this on YouTube, do us a favor and share this video and hit that subscribe button while you're at it. If you're watching on Facebook, just hit that like button and then hit the link to share this video with your people. It's so simple on social media, and with your help, we can get this message out to the people that really, truly need it. Again, I'm Dr. Jeff Williams with Creekstone Integrated Care. Until next week, take care of yourselves and everyone around you. And we'll see you then.